Greetings of the season. I am Dr. Vijay Warad. I am a practicing allergist and clinical immunologist, Sai Allergy Asthma Hospital, Pune. See, the fact is that in India, near about number one chronic disease in children is an allergy. In adults, every one third of the population, every third person is suffering with some or the other allergies. And while treating these patients, most of the patients are use the first generation antihistamines, which is very dangerous. In children below 12 years, for a long term use, it causes a cognitive and behavioral disturbances. Even a few years back, I presented a paper in Toronto, Canada on this and how it is affecting the positive psychology of the children and causing a significant behavioral and cognitive disturbances. In adults also, amongst the medicine consumed by the drivers and causing accidents, 78% of the accidents in even in USA are because of the sedative antihistamines. In India, so already our most of the drivers consume the alcohol, and on top of it, if they have antihistamines for any of these allergic conditions, it's a big problem. And then again, the productivity of the people working into the software industry or any of the other um, work also, their quality of life is very poor. So what is the option then? Because very few selective, non-sedative, safer antihistamines are there, and as these allergy patients, they require a long-term management of the proper control of the inflammation and the allergy symptoms. The proper anti-inflammatory antihistamines dose is important. Now we have a very good molecule like bilastine, which is very safe even above 6 years old children. There is a studies done. It's available in different formulations, and even if we increase the dose up to 80 milligram also above 12 years of age, it's very safe. Even few of my patients which are pilots, and I'm using this bilastine up to 80 milligram in different severe allergy cases. It's very safe. It is a non-blood brain barrier crossing antihistamines. It has a selective peripheral receptor antagonist, and it controls the very good rhinoconjunctivitis or urticarias, which is a significant problem nowadays. Even now, the post-COVID, we are seeing a lot of specifically skin itching allergies, even after the post-COVID or even the post-COVID vaccination also. In those cases also, practically I have found the bilastine is very useful. In children also, above 6 years, the syrup formulation is available. The combination with montelukast also is very good, and it can be used in a proper way. So, bilastine is one of the very good available molecule, a safer even for the long term effects also. It is non-tolerant. It does not cross the blood-brain barrier. It does not interfere with the renal or liver systems and all. And even most of the drugs can be given with the bilastine. So it doesn't have a drug-to-drug interactions also.